Recurrent pregnancy loss is a surprisingly and unfortunately common event in people's lives. It's where you have recurrent miscarriages or you're not able to grow a pregnancy past the first trimester. Usually having 2 losses in a row gets you the diagnosis of recurrent pregnancy loss. And we're definitely not talking about it enough. It's an emotional thing, but I want people to know that you're not alone in going through this. It can be just because, which is always really awful and sad. It could be because there's a structural anomaly or something in your uterus that's a little bit misshaped. It could be fibroids. It could be a septum. It could be because of an endocrine issue. You know, if your thyroid's not working quite right, or you have diabetes and it's not getting treated, or you have really bad anemia, there's other things that can be involved in it. There's also genetic reasons. You know, if your chromosomes have what's called a balanced translocation, you could pass something on to your eggs that become unbalanced, eggs or sperm that become unbalanced and therefore lead to increased risk of miscarriage. Treatment for recurrent pregnancy loss can vary, and it's up to the individuals, the couple, the person to make the decision that's right for them. So after we've done an imaging of the inside of the uterus, we've gotten their blood work, we've looked at their hormones, we've checked out their genetics, that if we find something, obviously we will do something to fix it. Let's say that there is a translocation, meaning you have the right number of chromosomes and the right amount of DNA, but there's a chance of passing on to your eggs or sperm that they don't, so increasing risk of miscarriage. We can actually go through IVF, where we create embryos outside of the body and then test those embryos through pre-implantation genetic testing to see if that embryo has the right number or right amount of DNA or the wrong number of chromosomes or the wrong amount of DNA. My main messaging for people is after we do this workup, we want to make sure that they know that the most likely outcome for most people that walk in the door after having had several losses is that they're going to bring home a healthy baby as soon as possible.